The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is a time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough physical exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me. I listen to them and see what they're saying, and I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. To maintain a clean and safe environment, my office has several ultraviolet C-wave lights to sanitize and kill bacteria and viruses. If you wait, it may be too late. To my military family, I got your 6. To my Masonic brothers, the light is bright. Today's topic, congestive heart failure. Congestive heart failure is pretty significant. Most people have a family member or know someone that suffers from congestive heart failure. During my, as a medical student and what we call externship and internship and residency, throughout the year, we would definitely have patients that were admitted with congestive heart failure, and we had to treat them. And I'm going to discuss, define what they are, what congestive heart failure is, and then signs and symptoms, and then we'll go into just briefly discuss treatment, because it's very complicated, and that's beyond the scope of this particular topic itself, because then I just don't want to cover every single drug medication. It's not necessary. It's just overall, just get a view and an understanding of what congestive heart failure is. Okay, so let's define congestive heart failure. This is a condition in which the heart has lost the ability to pump enough blood to the body's tissue. With too little blood being delivered, the organs and other tissues do not receive enough oxygen and nutrients to function properly. As I stated in so many shows, structure is function. Without proper structure, there is no function, rather dysfunction. It doesn't matter what part of the body, structure is function, and without proper function, there is no function, or rather dysfunction. So in this case, we're talking about the heart. We also define this as pump failure. And you hear the word failure, and that's kind of like misleading. That's like the heart stops. No, it just means that the heart is not functioning at optimal levels. According to the American Heart Association, about 4.9 million Americans are living with congestive heart failure. Of these, 2.5 million are male and about 2.4 million are female. So it's almost equal, but male, a little bit more than female suffer from congestive heart failure. 10 out of every 1,000 people over the age of 65 have congestive heart failure. There are approximately 400,000 new cases of congestive heart failure every year, meaning newly diagnosed. Congestive heart failure happens when a disease affects the heart's ability to deliver enough blood to the body tissue, as I stated above. Often, a person with congestive heart failure may have a buildup of fluid in the tissues called edema. All right. Heart failure, what we call congestive heart failure, with this kind of fluid buildup is called congestive heart failure. And I repeated myself there. Where edema occurs in the body depends on the part of the heart that is affected by heart failure, because we have what's called right side or left side heart failure. And I'm just going to briefly cover that because it starts to get really detailed and the physics and the physiology of the heart. That's beyond the scope of this topic itself. Again, it's just a brief overall discussion of congestive heart failure. Heart failure caused by abnormalities of the left chamber of the heart, which is called the left ventricle, means that the left ventricle cannot pump blood out of the body fast enough as it returns from the lungs. Now we're talking about left-sided heart failure or left-sided congestive heart failure. Because the blood cannot get back to the heart, it begins to back up in the blood vessels of the lungs. Some of the fluid in the blood is forced into the breathing spaces of the lungs, causing pulmonary edema. A person with pulmonary edema has shortness of breath, which may be acute, severe, or life-threatening. A person with congestive heart failure feels tired because not enough blood circulates to supply the body's tissue with the oxygen and nutrients it needs. Abnormalities of the heart structure and rhythm also may be responsible for left ventricular congestive heart failure. I'm talking about left side heart failure. So we have congestive heart failure as a global term, and then we can divide it into right-sided and left-sided. With left-sided heart failure, that is the big ventricle. All right. Now I'm going to explain the heart. We'll go over the atrium and the ventricles. So when we have the left side, that means we're having fluid build up back into the lungs, and you develop pulmonary hypertension, or we have pulmonary edema and pulmonary hypertension. That's very, very difficult to treat. So let's talk about the heart. The heart, I want you to think of a square and then put a plus sign within this square, and that breaks it up into quarters. Now the heart is, this is just for illustration. The heart is not equal in quarters, but just so you have an understanding. So there's 4 squares within a large square. Now, the top 2 squares are the atrium. The function of the atrium is to take blood from organs and then contract down and pump blood into the ventricles, which are the bottom 2 chambers. The function of the bottom 2 chambers, which is called the ventricles, those are your workhorses. The function of the ventricles is to pump blood into organs. All right, so they are the workhorse. And when we have congestive heart failure, those 2 ventricles, the workhorses, start to have issues, okay? And we'll get into the issues as I proceed. In right-sided heart failure, the lower right chamber of the heart, the right ventricle, as I just stated, cannot pump enough blood to the lungs as fast as it returns from the body through the veins. The blood then engorges the right side of the heart and the veins. Fluid backs up in the veins and is forced into the tissues, causing swelling, edema, usually in the feet and legs. Congestive heart failure of the right ventricle often is caused by abnormalities of the heart valves or disorders within the lungs. All right, so we have about a minute 35 left here. So I'm going to stop right here because then we're going to, again, we'll continue. It's going to get a little bit more complicated. I want to just everyone sit back to process what I just said. So congestive heart failure, it's what we call pump failure. It doesn't mean that the pump is failing, it stopped. It just means that the efficiency and that the heart is starting to be less efficient. It's not working like it should be. We're starting to get into dysfunction. Structure is function. Without proper structure, there is no function. And later I will talk about structure, okay, the actual structure of the heart, specifically the ventricles. So again, the heart, think of a square with a plus sign. Within the square, you have the atrium, which is the two boxes above, and then you have the ventricles, the two lower boxes, and those ventricles, the function of them starts to decrease. We have fluid backing up into the lungs. Okay, left-sided failure, or we have fluid backing up into the lower extremity, right-sided heart failure, but that's called congestive heart failure. All right, I have 30 seconds left, we're getting ready to count down. So let me help you lead a happier and healthier life. If you wait, it may be too late. In this case, you need to come in for a history and physical. Let me give you a thorough exam. We'll do routine blood work, and let's see if you have a condition, hypertension or congestive heart failure, and I can refer you out. To learn more about my business, go to drtommyo.com. That's drtommyo.com. Welcome back to the Dr. Tommy Show. I am your host, Dr. Thomas O'Brien. Today's topic, congestive heart failure. So let's go back and define what congestive heart failure is. Congestive heart failure is what we call a pump failure. Okay, this is where the anatomy of the heart, the ventricles, they start to lose the structure starts to change, and then the function decreases. The heart just doesn't work as efficient. It's not able to pump the blood at an optimal level, and then the blood starts to build up in either the lungs or the lower extremity. So let's continue. I left off, and I just want to where we were talking about the right ventricle often is caused by abnormalities of the heart valves and lung disorders, and we're talking about the right-sided heart failure. So let's continue. When the heart cannot pump enough blood, it tries to make up for this by becoming larger. Okay, this is where the structure, okay, the ventricles, the big workhorses in the heart, right? I said that there's a square, put a plus sign within this square. You have the two squares, smaller squares on top, and you have two squares on bottom. The top of the atrium and the lower two squares are the ventricles. To compensate, no, this is natural because the heart is a muscle. When the heart starts to work harder, the muscle starts to grow. Well, you think that's great. Yes, initially, if you're an athlete, you're a runner, the heart becomes more efficient. It doesn't work as hard. However, when there's pathology, the ventricles start to grow, and then there's an inverse relationship, meaning the ventricles, the wall, the muscle itself, the walls of the ventricles start to increase and to become less efficient, and that's when we go into congestive heart failure. So by becoming enlarged, what we call hypertrophy, okay, enlarged, okay, the ventricles cannot contract more strongly or pump more blood, and that's where the dysfunction occurs. Again, structure is function. The structure changes, then we have a dysfunction, okay? When this happens, the heart chamber becomes larger and the muscle in the wall becomes thicker, as I just stated. The heart also compensates by pumping more often to improve outflow. So your heart rate, your pulse increases. So we start to get into what we call compensatory patterns to try to compensate. And initially, that works. But after a while, that compensation becomes hurtful. It worsens the condition. So the kidneys try to compensate for congestive heart failure by retaining more salt and more water to increase the volume of blood, right? Because we're not able to push the blood. So what do you want to do? There's less resistance. We want to retain more salt. Salt is a magnet to water. So wherever sodium goes, water follows. So if we have increased volume, then the blood's going to have more resistance to push against. Well, that's not good, because then we're going to have more fluid retention. All right, more fluid retention. We're going to have more fluid building up in the lungs, or more fluid building up in the lower extremities. This extra fluid can also cause edema. Eventually, as the condition worsens over time, these measures are not enough to keep up with the heart pumping, and we have fluid buildup, and then we really start to advance into heart failure. Okay? Kidneys often weaken under these circumstances, further aggravating the situation and making therapy more difficult. Again, initially he's trying to compensate, and it gets worse. And then overall, now we have pump failure, and we're starting to look at the kidneys, and we can eventually develop a kidney failure, or what we call renal insufficiency, and then renal failure. For most people, heart failure is a chronic disease with no cure. Again, let's talk about cure. Everyone wishes for a cure. In medicine, there are no cures. People argue, there's cures. No, we are taught there are no cures in medicine. There's only treatments. A cure means that something will never, ever come back. That's not true, okay? We treat, because we know I can treat something, it will resolve, you're going to feel well, everything's fine, next you know, it returns. So that's a treatment, not a cure, all right? However, they can be managed and treated with medications and changes in diet, exercise, and lifestyle habits. And in end-stage heart disease and end-stage congestive heart disease, heart transplantation may be considered. What are common causes and symptoms? The most common cause of heart failure is coronary artery disease. In coronary artery disease, the arteries supplying the blood to the heart become narrow and blocked. In my previous shows, I discussed the significance of micro and macrovascular pathology. This keeps coming up every time. You hear it in diabetes, you hear it in my cholesterol, right? My show. We have what's called arterial atherosclerosis, hardening of the arteries. They become less flexible, and then the heart has to start working harder to push blood through a narrowed artery, and we have less blood supply. So what's going to happen? We're going to have changes in the tissue. Again, structures function. Without proper structure, we have no function or dysfunction. So when blood flow to the area of the heart is significantly decreased, the heart muscle suffers damage or tissue death. If the damaged tissue is significant enough that it affects the heart's ability to pump blood, heart failure develops, or what we say congestive heart failure develops. Cardiomyopathy. It's a general term which describes the size of the heart. Cardiomyopathy. Heart tissue starts to get larger. Myopathy, okay? So, cardiomyopathy may be caused by coronary artery disease, again, macrovascular pathology, hardening of the arteries, and various other heart problems or recreational drug use, and even with steroid abuse. We're starting to see a lot of, over the past 20, 30 years, you saw the professional bodybuilders, or not even professional bodybuilders. These guys are pushing a lot of, they call it gear, we called it roids, the sauce, whatever you want to call it. They have a lot of fluid retention, and you end up developing congestive heart failure or heart attacks. So this is a cause for congestive heart failure. High blood pressure, uncontrolled high blood pressure is a common cause of heart disease. Defects in the heart valves, congestive heart failure, heart disease, alcoholism, drug abuse, as I just stated, and damage to the heart. All right, I got about 2.5 minutes left before the show ends. Time really flies here. And I have so much to cover because this is a very complex medical condition here. So I'm just, starting to go through this really quick. A person with heart failure may experience the following. Shortness of breath. Why shortness of breath? Well, when we have fluid building up in the lung, we're not able to breathe, okay? We're basically drowning, our lungs are drowning. We're drowning within our own fluid. Frequent coughing, especially when lying down, again, because we're having the edema in the lungs, pulmonary hypertension or pulmonary edema. swollen feet, ankles, and legs. You're going to have fluid build up, and we'll have what's called, when it really gets severe, pitting edema, where I can actually squeeze the lower extremity. You're going to see my fingerprints within the tissue itself. I'm talking about the skin. That's called pitting edema. Fatigue. Remember, your heart's not pumping well. You're not getting enough oxygen to the tissue, nutrition to the tissue, and you're carrying excess fluid. All right. So increased weight. And if it's in your lungs, you're not breathing well. All right. So dizziness or fainting. Again, we got a pump failure. So we're not able to keep up with the body's demands. So you're going to feel a little dizzy or lightheaded. And then we have sudden death. I mean, that's not good. So we only have about a minute left here. Let's just go real quick and then we'll wrap up the show. Diagnosis of heart failure is based on symptoms, medical history, a physical exam. Like I said, I look, listen, and feel my patients. I feel them both physically and emotionally. So we need to know what's going on. You have to do a thorough history and physical. You can do x-rays and then you can see the heart is enlarged, echocardiogram, and then EKG. It will show some changes, and then cardiac catheterization and looking for the pressures within the heart. How do we treat it? Lifestyle changes and medications. You have to follow up with your physician. Listen, be medically compliant, and then we should have some success there. All right, so we have 20 seconds left. Let me help you lead a happier and healthier life. If you wait, it may be too late. I offer a very affordable concierge practice at the prices less than the cost of a monthly cell phone bill, which allows you access to the quality care you really deserve. So to learn more about my practice, go to drtomio.com. That's drtomio.com.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.